Good afternoon, everyone. Thank you for coming to today's session. My name is Ileana Soda-Welty, and I'm the Executive Director of the Multi-Ethnic Collaborative of Community Agencies. We're excited to be hosting our third and last session of the Health Equity Series. You can watch our last two sessions on MECA's Facebook or YouTube pages. This session is live on Facebook and will also be recorded and available in those platforms after today. Today's topic is addressing structural and systemic change to advance health equity. Our amazing presenters today will share their work, and our goal today is to talk about how our activism, advocacy, and agency can advance a movement for creating structural policy and systems change. We aim to discuss what sustained collective anti-racist, racial justice, and equity efforts can mean for our society, and also discuss the challenges that arise in community change efforts. Anytime we begin to disrupt the current power structure, we face resistance. So how do we reimagine and reframe this work in a way that where we can put aside our self-interest, fears, and projections to think about the impact we can have at the community, organizational, and systems levels? To guide us through this conversation about how we can move forward and advance and not go backwards, we have the pleasure of having some very special speakers with us today, including Dr. Thema Bryant, Professor at Pepperdine University, Dr. Lisa Spienerman, Associate Dean and Professor at Arizona State University, April Jean, Policy Director for the California COVID Justice Initiative with Public Health Advocates, Flo Kofer, Senior Director of Policy at Public Health Advocates, and Hu Nguyen, Director of Population Health and Equity at the County of Orange. I'd like to pass it on to my co-host, Dr. Miguel Gallardo, our Director of Research and Evaluation and also a Professor of Psychology at Pepperdine University, to introduce our first speakers and share his thoughts.
Great, thank you. Yeah, I'm not going to share a whole lot of thoughts because I know we don't have a whole lot of time. And so really want to just welcome everybody and appreciate all the interest. I mean, there's been a enormous amount of interest for these webinars, and so thankful for that. It also means that there's a desire and need to learn and to try to do things differently, hopefully moving forward. So we had quite a bit of a turnout for this one registered, and so we're excited about today. And so I'm going to introduce a couple of colleagues of mine, Dr. Thema Bryant and Dr. Lisa Spannerman. I'm going to introduce Dr. Bryant first, who will speak first. And then when she's done, I'll introduce Dr. Spannerman, who's going to present after Dr. Bryant. So as I introduce Dr. Bryant, I want to just first say that I'm delighted and overjoyed to say the first thing I'm going to say about Dr. Bryant is that she is the incoming president-elect of the American Psychological Association, which is a huge deal, by the way. It's the leading scientific and professional organization representing psychology with more than 120,000 members. And so to be at the helm of that organization is a pretty big deal, and also deservedly so for Dr. Bryant. I think when you hear her speak today, you will see why she was elected, among many other reasons, why she's in that position at this moment in time. So we're honored and we're pleased that she's able to join us today, given the many roles that she occupies. As Ileana mentioned, she's currently a tenured professor of psychology at the Graduate School of Education and Psychology at Pepperdine University, where she directs the Culture and Trauma Research Laboratory. Her clinical and research interests center on interpersonal trauma and the societal trauma of oppression. She's also a past president of the Society for the Psychology of Women and a past APA representative to the United Nations. She currently serves as the elected vice president and racial equity officer for her neighborhood council in Los Angeles. She also has served on the APA Committee on International Relations in Psychology and also the Committee on Women in Psychology. She's been honored by the American Psychological Association for her distinguished early career contributions in psychology and the public interest in 2013. The Institute of Violence, Abuse, and Trauma honored her with their Media Award for the film Psychology of Human Trafficking in 2016, and the Institute honored her with the Donald Friedley Memorial Award for Excellence in Mentoring in the Field of Trauma in 2018. Here in the state of California, the California Psychological Association has honored her for Distinguished Scientific Achievement in Psychology in 2015. And she's also the editor of the APA text Multicultural Feminist Therapy, Helping Adolescent Girls of Color to Thrive. She also has other books as well, and an upcoming book on an anti-racism handbook, which we'll also put into the chat for those to grab a copy of as soon as it's published. She is one of the foundational scholars on the topic of trauma of racism. She's raised public awareness regarding mental health by extending the reach of psychology beyond the academy and private therapy office through community programming and media engagement, including but not limited to headline news, NPR, and CNN, among many others. So, Dr. Bryant, I'm going to turn it over to you, and we're just so thankful and glad you're here with us today. Thank you.
Oh, thank you so much for having me and for that warm introduction. And you all should know that Dr. Gallardo is a key member of my dream team, the campaign team that allowed this to happen. I'm so grateful for our host and sponsor, as well as my colleagues who will present after me on today, and grateful to each of you for joining. I woke up this morning with my mind stayed on justice. I woke up this morning with my mind stayed on justice. I woke up this morning with my mind stayed on justice. Hallelujah, hallelujah, hallelujah. It is a good day to be dedicated to anti-racism. It is a good time and a good season to commit ourselves to health equity. And as we look at health equity, addressing in particular the disparities facing racially and ethnically marginalized clients. And so I want to talk today about cultivating anti-racism from a psychological perspective. And as has been shared, many of these principles are from my co-authored book, The Anti-Racism Handbook, along with my colleague, Dr. Edith Arrington. So in terms of my positionality, my pronouns are she, her, and hers. I am a woman of African descent. I want to name that I live and work in the land that has been cultivated by the Tongva peoples and other indigenous peoples. And along with doing a land acknowledgement, a labor acknowledgement is also important. When we look at the youth of this nation, the relatively young age of the United States of America, and yet its ability to develop so quickly, that is in large part to the labor, the exploited labor of primarily people of African descent. And so I want to acknowledge their labor and that it is on their backs and their sacrifice and their pain that we are able to be where we are today, not just Black Americans, but all Americans. And so as I talk about anti-racism, I want to let you know that I release the assumption of neutrality, that I am not just looking at this because it's intellectually interesting or that I'm curious about it, but that there are literal lives hanging in the balance when we think about health equity and who pays the cost when we do not have access to quality health, who pays the cost when oppression diminishes our physical and mental health. And so it is essential that we approach this work with an agency. Some people have talked about the need for more civility and conversation, but we need more than conversation. We need our outcomes. We need measurable change so that people's lives are enhanced and the quality of their lives is enlarged. We are meeting during these times of multiple traumas, the medical trauma of COVID-19, as well as the trauma of racial oppression and other forms of oppression. And so we need more than awareness. Many times people shy away from using the word racism, and if we cannot name it, then we cannot address it. So we want to not only be aware of people's culture, but we want to be aware of the systems of oppression, including within physical and mental health, and the need to disrupt and dismantle those systems very actively. So we are looking beyond awareness raising and looking for eradication, looking for shifting, looking for dismantling, and building something new. Of what will our systems look like when they really are coming from a vantage point that everyone's liberation and wellness is a priority. So in our research, we understand that there are a number of psychological barriers that keep people from engaging in anti-racism. The first one I will mention is avoidance. And so for white people, often they have not been socialized to have a comfort in talking about race and racism, but instead it gets put in the category of something to avoid. So to not talk about racism, not talk about politics, not talk about sex. And when we avoid these topics, we cannot address them. And for people of color, there is often a mindset in the health industry to avoid having conversations about race and racism because of not wanting to be labeled as divisive, as problematic, as angry, and also because many of us have been socialized professionally to equate professionalism with silence. And if you raise the issue of racism, people will say that you're being political or you're taking things personal. And so one of the big mindsets for us to overcome in order for us to do this work is to stop the avoidance and to choose engagement. Another psychological barrier is once people become more aware of racism and its effect on our health and the ways in which it is pervasive within the healthcare systems, is this piece of getting stuck in guilt. And we will see this often with white persons and privileged people of color who will say, I didn't know, and now that I know, I feel so bad. And so one of the ways that we work around anti-racism is to say it is not enough for us to get stuck in feelings of guilt and shame, either guilt because of our ignorance, guilt because of how we have benefited, guilt because of our silence, but then for us to be mobilized and motivated to activate in the aftermath of the awakening, so that if you were not aware about the impact of racism in terms of racial stress and racial trauma, once it comes to your awareness, if you were not aware of the disparities that exist, once it comes to your awareness, the disparities around maternal death and death by COVID-19 and asthma, when you start to be aware of all of these disparities, including mental health interventions and access, then we have to go from awareness to mobilization. Another psychological barrier is the victim blaming and respectability politics. So this is the notion from social psychology, which is the belief in a just world, which is if people do right, they will be treated fairly. And if they're being treated badly, they must be doing something wrong. And so that social psychological concept keeps a lot of people from engaging in anti-racism efforts, because if people of color are suffering, they must not be taking care of their health, they must not be eating right, they must not care, they must be resistant to services, they must just be scheming in order to get drugs. So there are all of these narratives that keep people from taking responsibility for the ways in which the systems consistently fail people of color and other marginalized communities. And so we have to get to a place where we're willing to actually confront our fears. And the reality is, when you do anti-racism work, there are consequences. So the fear is not a figment of our imagination. White allies or white comrades who get involved in the struggle get labeled, and we have seen in news events even can pay with physical health consequences as well, in terms of even the taking of their lives. And so when we are willing to speak up as white allies and comrades, as well as people of color, you can be labeled, you can be ostracized, you can be isolated in particular ways. And so it can be frightening, which is why it is important that we determine our advocates, that we mobilize collectively, and that we engage from a vantage point of being prepared for the backlash. And in many of our systems, as we start to make efforts toward anti-racism and health equity, there will be those who are trying to protect the status quo. And so our activation has to be on multiple levels. Racism is interdisciplinary. It shows up in all of our different pathways. And so then anti-racism has to engage on all of those levels. And so as we navigate the people, so the training of mental health professionals, social workers, nurses, doctors, health administrators, as we look at the ways in which places are set up, where they are positioned, and who has access, even in terms of geography. And then once people get in the space, how they are treated and how the space is designed for people's wellness or for their degradation or erasure. And so we want to be very intentional about being anti-racist in our practice and in our policies. And so that is where the equity comes in, to look at the impact of our equity, the impact of our policies, our health policies on the well-being of people across marginalized communities. We also want to be aware of anti-racism in parenting and mentoring as we look at the impact of racism across the lifespan, even in terms of the health of babies, and I mentioned maternal death, all the way to the health of elders. We also want to be intentional about recognizing the impact of racism on people's health so that we can be mobilized to shift it. We also want to be aware that people of color endorse higher rates of religiosity and spirituality. And so if we are going to address their health, our health, that we have to look at it holistically, mind, body, and spirit. And so healthcare systems and health professionals that ignore spirituality are unethical. They are participating in erasure and really a supremacist notion of what health, identity, and wellness are. And finally, we recognize that when we are doing this work, we want to be intentional about refilling our well, that this is not a sprint, it is a marathon. And for it to be sustainable, those who are engaged in anti-racism efforts have to take seriously their own rest and restoration. That what does it mean to hold on to our love and compassion for each other as we are navigating hostile systems and hostile circumstances, and even to have joy in the midst of the process so that we are not consumed by racism. So racism has an impact, but it is not the end of the story. And collectively, as we push past our own psychological barriers so that we can show up to do the work, then amazing things can happen. Thank you so much.
All right. Thank you, Dr. Bryan. Appreciate it. Appreciate it. Thank you so much. We're going to, yeah, we'll do the golf clap via Zoom. We will, yeah, that's right. This too. We will, we'll have some time for Q&A a little bit later as well. Hopefully with some of our attendees. But I'd like to now bring in Dr. Spannerman, who's on the screen and visible to everyone now. Want to introduce Dr. Spannerman as well. Dr. Spannerman is a professor and faculty head of counseling and counseling psychology and associate dean for academic personnel and faculty success in the College of Integrative Sciences and Arts. In 2012, she was actually at Arizona State University. Let me say where, at Arizona State University. In 2012, Professor Spannerman was recognized by the American Psychological Association Society of Counseling Psychology with the Fritz and Len Cooter Early Career Award. She's a fellow of the American Psychological Association, and from 2012 to 2015 served as vice president for scientific affairs for APA's Society of Counseling Psychology. With more than 60 peer-reviewed articles and refereed book chapters and a co-edited book, her research focuses on racial microaggressions and white individuals' racial attitudes. Along with Dr. Daryl Wing Su in 2020, Professor Spannerman published the second edition of Microaggressions in Everyday Life. She's also served as associate editor for the Journal of Diversity in Higher Education from 2016 to 2019. And she has received several teaching awards, including the University of Illinois Provost Award for Excellence in Graduate and Professional Teaching. And during the 2018-2019 academic year, she was the fellow in residence at the Center for Interdisciplinary Research in Germany. So welcome, Dr. Spannerman, and we look forward to your presentation today. Thank you. Thanks for being here.
Thank you so much. Um, it's such a joy to be here, and especially to finally meet my colleague, Dr. Tamar Bryant. And thank you for that amazing talk. It's such an honor to be alongside of you presenting. I wanted to say thank you to the Multi-Ethnic Collaborative of Community Agencies and to Dr. Gallardo for inviting me to present today. Upon reading about the vision of your organization to enhance and improve the quality of life for underserved multicultural communities and the work that you do, it's just truly an honor to have a chance to share my thinking and some of my research with you today. I'm going to draw primarily from two papers that I published. The first in 2017 with my colleague, Laura Smith, professor at Columbia University. In one of our flagship journals, The Counseling Psychologist, we put together a collection of articles focused on the roles and responsibilities of white racial justice allies for research, teaching, and clinical practice. And the second article, which I think dovetails nicely after Dr. Bryant's talk, comes out of that interdisciplinary research team that I was a part of in Bielefeld, Germany, where we were focused on whether guilt can be a culturally productive force. And my contribution was to focus on white guilt. And we recently published the edited volume where I was examining the role of white guilt among white activists in the summer of 2020, Black Lives Matter, after the brutal murder of Mr. George Floyd. So looking now at just what I'm going to discuss briefly, I'm going to talk about some of my research on white protesters in the summer of 2020, some potential pitfalls of white ally work, some possibilities for white folks who engage and develop a commitment to racial justice activism, and then just some recommendations that have come out of my research participants over the years in terms of micro level and macro level changes. And first, before I share these photos, I wanted to just talk about some data from the Pew Research Center that showed that white support for Black Lives Matter stood at about 40% after a police officer killed Michael Brown in 2014, and then increased to 61% after the officer murdered Mr. George Floyd this past summer. And so that over 20% is a significant jump. And so I want to share several photographs from popular media sources to show this incredible amount of white people, many for the first time, who participated in Black Lives Matter protests in the summer of 2020. And so this is demonstrators in Portland, Maine, where they're demanding an end to institutional racism and police brutality. Here, this is an example of protesters rallying in small rural communities, and this is in Anna, Illinois. Protesters march out of Civic Center Park in Denver, Colorado. And here in Washington, D.C., at the National Cathedral, you see a white woman holding a sign that says "White silence equals compliance." And this was another protest supporting Black Lives Matter. And then finally in Rochester, New York, there's a diverse group of demonstrators who come together, and the sign reads, "If you're not anti-racist, you are complicit," which was the sentiment among many white folks who came out in solidarity in the summer of 2020. However, and not surprisingly, just a few months after the protest, and not even that long, in mid to late September, new data suggested that support for Black Lives Matter among white folks was already declining back to levels that were prior to Mr. Floyd's murder. So, you know, the question for us as scientists is what helps these who are these white folks? What helps them to develop a longer standing commitment, and why isn't that the case? And so these are some of the questions that we're trying to answer. My research lab and I collected data shortly after the protest to try to understand who are these white folks who are out there demonstrating. And we collected data from 199 white people across the country, ranging in age from late teens, 18, 19 to 70s, and just a wide range of folks. And we used a statistical technique that I'm not going to really get into here, but latent profile analysis to come up with solution of who are these, how many types or profiles can we identify from the data. And the best solution that fit was this 3-profile solution that I'm going to briefly just talk you through. So all the way on the right-hand side, you see that we have what we are calling committed racial justice activists. And 77 of the nearly 200 participants scored in this profile. Their scores on measures of individual and institutional advocacy and critical anti-racist action are the highest among the 3 profiles. We also did some post hoc analyses comparing the 3 profiles with demographic and other kinds of characteristics. And we saw that these committed racial justice activists had a long-standing commitment to racial justice activism. This was not their first march or demonstration. They had been doing this some for 10, 20, 30 years. And then they also had meaningful relationships with members of BIPOC communities. And that to me really stood out as something that differed from the other profiles where they did not have those meaningful friendships and relationships. So it's different than just saying, oh, I have a Black friend, so I can say I'm not racist. These were true connections and true solidarity. In the middle, we have what we're calling for now racial justice tourists. And they're the lowest on individual and institutional advocacy. They have the highest colorblind racial attitude scores using the scale from my colleague, Dr. Helen Neville, and only a small number of participants scored in this profile. And we did follow-up interviews with folks. And so some of these participants, they only attended because their mother asked them to come with them, their daughter asked them to join along, their brother, their friend said, hey, we're going out to march, why don't you come with us? And they were curious and they wanted to check it out. The third profile on the left-hand side, we have what we're calling emerging or emergent racial justice activists. And their scores are somewhere between the other 2 profiles. And these folks likely account for the surge in white people that we saw in the photographs supporting Black Lives Matter during the summer of 2020. And it's likely, unfortunately, that most or many of them are no longer engaging in racial justice activism now. And important next steps for research in my lab, and I know other folks are doing this, would be to find out what factors influence that movement from emergent to committed. And I pulled these just as an example of committed white racial justice allies. And I was thinking of Ben and Jerry from the ice cream company, because they released a statement that they titled "Silence is Not an Option" shortly after Mr. Floyd's murder. And they called explicitly for a dismantling of white supremacy and an act of solidarity. And so what we found from some of the literature and from some of our own recent participants in this study are some characteristics of committed white allies. And committed white allies demonstrate a nuanced understanding of institutional, structural, and systemic racism and white privilege. So they see the structural, the macro level expression of racism, and they don't just view it as an individual act, which we know is crucial. They enact a continual process of self-reflection about their own racism and positionality. And for white folks, this is hard. It's hard to do. It's sometimes quite ugly. They express a sense of responsibility about continued racism in society, and they use their privilege in ways that promote equity. Related to the sense of responsibility, they engage in actions to disrupt both micro and macro level racism. They participate in coalition building and work in solidarity with people of color. And some of our participants said that one of the most impactful things that they learned early on in their activism as a white racial justice ally was kind of shut up and sit down, white girl. And being able to see that as a way to be different in the world, to listen and to join rather than to have to dominate and lead was a really, really important lesson for these folks. And finally, and Dr. Bryant spoke about this a little bit, is that committed white racial justice activists, they encounter resistance from other white folks. And this could be family, friends, strangers. We're seeing this in the popular media, and it's really important for us to address, especially if we want to help that movement from that emergent activist to a committed activist. There's also been a host of literature on the pitfalls or the self-focused performativity of white anti-racist work. And this conversation has exploded after 2020 summer in both the popular media and the scholarly literature. And I'm not offering an exhaustive list, but here are some of the problematic pitfalls of which white people must remain vigilant. And the first one is a paternalistic or the white savior trope, as you see in this photograph, which is from the Hollywood motion picture, The Blind Side. And, while white people may think that they're being helpful, they're actually conveying a subtle form of superiority that dehumanizes members of BIPOC communities. As we saw with our profiles, and especially that emergent profile, all too often, white racial justice ally efforts are superficial, fleeting, and transitory. So it's really crucial to think of how to have a deeper and lasting commitment in developing that. Another common pitfall is this tendency to over-identify and demonstrate a false empathy. So it could be, I'm queer and I experience heterosexism, so I understand your pain as a Black man, or I'm a woman and have experiences with sexism, so I understand your experiences with racism. And while certainly experiences with other forms of oppression might in some cases provide a bridge to help people understand other people's experiences with racism, most often they do not, and they can cause a further rift for white folks with members of BIPOC communities. And then finally, white racial justice allies may have a tendency to overemphasize, as I mentioned earlier, the micro level process or individual acts of racism and ignore macro level structures, institutions, and systems. So on the flip side of these pitfalls, there are also possibilities. And I have a decades-long research agenda on the cost of racism to white people. And by costs, I'm referring to the negative consequences of being in the dominant position in an unfair and unjust racial hierarchy. And while these costs are in no way comparable to the egregious costs that members of BIPOC communities must deal with on a daily basis, and some of which Dr. Bryan alluded to, nonetheless, they're important. And some of these costs are living in a state of irrational fear of BIPOC people, and especially Black and brown men, having a distorted picture of reality, namely believing that the US is a level playing field where everybody has an equal shot at success, and having only white friends and missing out on the joys of expanding one's networks and having true connection. In contrast, white committed racial justice activists have documented the following individual and collective possibilities that result from using one's privilege to promote equity. And they often speak of personal growth. And they say things about when you learn about your own racism and find ways to unlearn it and develop new ways of being in the world, there's a wonderful sense of wholeness and growth that comes with that. They talk about greater authenticity and integrity and having a more accurate perception of oneself, of other people in the world, other people's experiences, and of reality in general. When we realize that we don't actually live in a level playing field, a whole new way of being opens up. Widening one's social network comes up over and over again, and feeling a sense of a connection to a larger community of people dedicated to racial justice. And joy and a sense of empowerment that comes with all of these experiences often emerges also in my colleague Laura Smith and her colleague Reddington's work, very similar kinds of findings for these committed activists. And then ultimately, this results in a fuller humanity and love. And as one of our participants in the 2017 study expressed, he said, although racial justice work is difficult, there's a redemptive quality to it that is tied to Dr. King's philosophy, an ethic of love. So I'll leave you today with just some recommendations for white racial justice ally work, both micro and macro level, that actually come from the voices of our participants over the years. And they say, stop hanging out with people who are clones of yourself, and instead seek out people who see the world in quite a different way than you do. Establish meaningful cross-racial relationships and listen, truly hear people's perspectives, and you'll undoubtedly be confronted with your own racism and opportunities to grow. Engaging in self-reflection, it's critical, even when it's painful. And this comes up over and over. And for those of us who are teaching multicultural and racial justice principles, you see the pain in the white students as they begin to see reality accurately, but it's really crucial. Take risks, make mistakes, and develop recovery skills. And some people who have dedicated their lives to this work talked about how crucial it is to have these recovery skills, and it's almost more important than getting it right the first time, because when you're socialized as a white person in a racist system, you're going to make mistakes. It is very hard, obviously, to unlearn decades of racist socialization. And so it's the unlearning and developing recovery skills and being able to engage after you make a mistake, which invariably white people, we will. And then as Dr. Bryant talked about, engaging in self-care when doing this work is really, really critical to the sustained commitment and staying in the game. And I think, engaging in the self-care also is part of these networks of solidarity to be able to come out day and day again and make a difference and enact change. On the macro level, it's crucial to advocate for structural changes in one's workplace and the organizations in which we're involved, supporting justice-oriented associations, revising training curricula and approaches, and then fostering systemic and deliberate development of white racial justice allies. My colleague, Professor Bill Cross, commented on one of our articles, and something that I really took to heart was that he said, it seems that so much of the development of white racial justice allies seems serendipitous and happenstance. And we really need to think carefully and critically about how are we going to set an agenda that deliberately fosters the development of white racial justice allies. And I will stop there and thank you so much. It's really a joy to be with you today.
Thank you, Dr. Spannerman. Appreciate it. Really great information, and hopefully, I know it'll be really helpful for many of the folks listening. Who, I find that a lot of what we hear a lot, particularly at this moment in time, is a lot of white-bodied individuals trying to find their space and their place in this work, and then some avoiding it altogether because they don't want to misstep or say the wrong thing. And so I'm really grateful for your work and for your time today and suggestions. So hopefully we'll have some time for Q&A at the end as well. So thank you. All right, Ileana, I'm going to turn it back over to you.
Sure, thank you. It is my pleasure to introduce two great leaders at Public Health Advocates that I've had the pleasure of working with this past year as part of the California COVID Justice Recovery, Response, and Repair Coalition. April Michelle Jean, first, is a racial justice trainer, consultant, community organizer, and systems change strategist whose 18-year career has focused on illuminating the impacts of race and racism on systems, institutions, organizations, communities, and individuals with a specific focus on mitigating disparate outcomes for individuals who identify as Black African American. In her training and consulting, she examines the impact of race and systemic outcomes to promote liberation and justice for historically marginalized and disenfranchised communities. Her specific niche is in training organizational leaders on cultural responsiveness, equity, racial justice, and systems thinking approaches. Ms. Jean is currently the policy director for the California COVID Justice Steering Committee, and she leads an integrated campaign calling for public health, healthcare, economic, housing, food, and water access, and other protections and interventions to protect the health of the public and support historically underinvested communities during and beyond the COVID pandemic. Dr. Flo-Jane Griffin-Culfer is an epidemiologist who serves as the Senior Director of Policy for Public Health Advocates. She manages a team of staff leading health equity initiatives focused on California state policy, boys and men of color, entitled My Brother's Keeper, community-based first response transformation, youth trauma prevention in cities, called All Children Thrive, and most recently, public health response, the California COVID Justice Recovery, Response, and Repair Initiative. Her professional interest is addressing emerging and persistent public health challenges through research, policy, and community engagement. Her work primarily focuses on public health prevention. Ms. Flo received her bachelor's degree in chemistry and women's studies from Spelman College. She earned her master's in public health from the University of Michigan School of Public Health, as well as her doctorate in epidemiology. She is an alumni of the California Epidemiologic Investigation Service and the NAMI Emerging Leaders Program. Welcome to both of you. I'm looking forward to your presentation.
Thank you so much. I'm going to kick us off, and then I'm going to turn this over to April, who I have the pleasure of co-presenting with today. So thank you so much, Ileana, for that really warm introduction. And I have been tasked with talking a little bit about public health advocates and giving you part of our approach to doing racial equity work. And so part of what we do, Public Health Advocates is a 22-year-old nonprofit organization working statewide in California. And part of what we do is we work with historically disadvantaged communities to promote policy systems and norms that foster health, equity, and racial justice. And we emphasize historically because that's the frame that we start with. History is the root of what we do, and we are really intentional about making sure that we are not taking a cross-sectional approach to understanding what's happening in our communities, but recognizing that policies were passed that intentionally inflicted harm on communities and that we can't shirk away from that. So I've really appreciated what Dr. Tama Bryant and others have lifted up already on this webinar around the importance of speaking the name of racism, speaking the name of history, because without it, we often will end up drawing false conclusions or coming up with short-sighted solutions to problems that go much deeper and have a much richer history. And that's really the importance of having some reconciling with what we're experiencing and what the causes are. And so how we do this work is, first and foremost, bringing a health lens to some of the most pressing issues of our day. We see the importance of raising health, not just because of the ways in which our physical, mental, and emotional health certainly shapes our experience, our human experience as we walk through our lives, but also because it's connected to our humanity and our personhood. And there's a way that sometimes when we're having conversations, especially in policy spaces, that we move away from the actual impact that this is having on real people. And I was having this conversation with April earlier about the importance of recognizing that we're human beings with emotions and with experiences, and that our health is one of the sentinel events of how those experiences are showing up for us. And so we also do this work by challenging the social and the political and the economic systems that perpetuate these disparities, recognizing that there is an actor in a system that's perpetuating these, and that we can't just all, shake our hands and say, I wish things were different, but there actually has to be some intentional action that's coupled with that. And that's part of what our role is using our influence and making sure that we are sharing that spotlight by working with residents to make sure that the tools to advocate for structural change and policies are there. Because especially sometimes when we are in the process of just trying to survive, it can be very difficult, especially when systems are not designed to do this work, to be able to think preventively and to be able to think long-term and to be able to think about root cause solutions. And so that's part of what we see our work as being, is really anchoring on what's possible and figuring out individual steps to be able to move that forward. And so part of that is, working at both the state and local level to be able to advance policies that are equitable and that are just. And so part of what we're also doing is as we're addressing these critical issues, we are lifting up specific topics. And so as an example of that, nutrition and physical activity, we have work that's focusing on childhood trauma. We have work that's focused on transforming our public safety systems. And of course, what we're going to talk a little bit more about when I turn this over to April is the social and economic impact of the COVID pandemic, which we recognize, again, is rooted in history. And if I had, if you had taken me back to the middle of 2019 or maybe even 2018 or even before that and said, we're going to have a global pandemic, who do you think is going to be most impacted? I could have told you then without knowing any of the details of that pandemic because of history. And so we see at our core that racism is a public health issue. It is one of the key factors that is shaping what we see in terms of people's health outcomes and their lived experiences. And so that's the challenge, the ultimate root cause challenge that we're trying to address in many different ways, is how are we addressing the racism and rooting out the racism that is causing poor outcomes. And we've chosen policy as one of the ways that we do that. And so just wanted to highlight some of our programs because we are a mid-sized organization, and we have a lot of campaigns that are happening across the state that are bringing together communities and really trying to work on a number of issues individually, but all, again, going towards that major goal of racism as a public health crisis and better understanding how we can approach our communities and think about our policies as a way to be able to transform them in a way that promotes our health and well-being and roots out some of those harmful practices and policies. And so how we do this work, right? We've talked already a little bit. I've mentioned that, we're working in multiple places across the state. And so we do engage in multi-city campaigns. One of the reasons for that is that, communities are different across the state. And I think that goes without saying, but certainly wanting to move away from the painting with a really broad brush and assuming that everybody is doing the same thing and is going to have the same outcomes. And so we really like to work with communities and to learn from them, because we recognize that even as we may be bringing tools and we may be bringing strategies, there also is lived experience and expertise that's coming from individual communities, and that any of our work has to be rooted in that. And so part of the way that we are engaging in our focused local organizing is to think about ourselves internally. How do we organize? How do we, do our own work? What are we doing for our own staff? Because I literally had this conversation with April earlier. If you're going to social work the whole world and then your own home is a mess, what was the purpose, right? And so part of the things that we think about are all of our staff have equity goals. So we're not just saying equity is some add-on that you're doing in addition to your job. It is your job, and you need to be able to operationalize what you're doing to move your work forward. And that includes our finance and admin staff. That includes our executive director. Everybody in our organization has an equity goal that they are then being evaluated on and are moving forward, because we think this is central to what we do. We also believe in having, work-life balance, because we recognize as an organization, especially that's predominantly people of color, that there is a way that this work is really personal to us, and that it can really be, it can really overwhelm us in ways that, circumvent our self-care. And so if we're talking at a systems level about how we better care for people, certainly we have to be doing that individually. We also, are trying to make the implicit explicit in the ways that we do things. And we're really trying to do away from harmful practices where we partner with communities and we're the ones being paid and our communities aren't. So all of our initiatives, when we engage with community members or external partners, we find ways to make sure that we're compensating them for their time and for their expertise, because we recognize that that is important. And one of the other things that we do as we're engaging in the strategic research and the state policy campaigns is really thinking about what criteria we're using to be able to do this work. And so we have a set of about 10 criterion that we use to be able to think about what we're doing and make sure it's as impactful as possible. And the first one is really looking at equity and being able to say, like, Does this, does the policy we're considering actually, incorporate an equity lens? What does that mean? Is there, intentional consideration given to that? We also look at addressing root causes of systemic issues. So is this a temporary fix, or is this something that's going to address a long-standing challenge? Is there community engagement that's built into how we're going to do this? Does this policy actually address the issue it's attempting to solve? So often a solution will come up and you're saying, show me on the logic model how these two things connect. Is there, what's the timeliness of the impact? Because some issues can't wait and other issues can. And so do we have a short-term, an intermediate term, and a long-term strategy? Is there, what is the cost or perceived cost, right? And how will that be covered? I always believe that there's plenty of money out there, but it's a matter of mobilizing those resources. And then also looking at some of the more insidious ways that racism can infuse itself into the work you do, like grandfathering clauses. Is there a way that we say we're going to do this really new important thing, but then we're going to grandfather in all of the people who are already doing something different so that the change takes longer to take root? Are there ways in which we have decided that we're not specifically going to think about the rollout and the implementation, we're only thinking about passing the policy? And so those are some of the ways that we are really trying to think critically about our strategic research and our state policy campaigns in order to be able to raise up equity issues and do this work in an intentional way. Because if we just use them as platitudes and we don't have ways to operationalize them, we often will end up doing the same thing out of expediency, because part of white supremacy culture will compel us to continue to do things as they always have, because there's always a limitation of time and there's always a way that we anchor on what we've always done. So we're really trying to slow down and be thoughtful about how we engage in this work, so that we're able to actually make the changes internally that then change how we engage in the work externally. And so with that, I'd like to turn it over to April to talk about our California COVID justice work, which is one of the initiatives that we've lifted up that's really rooted in this framework.
Awesome, thank you, Dr. Flo. Go ahead and pull up my presentation. Okay, can we all see that? I'm hoping.
No.
Yeah.
Oh, okay, see, I thought so. It's like something's not happening correctly. There we go. All right, so thanks, Dr. Flo. So I'm gonna jump right in and talk a little bit about the California COVID Justice Initiative that I have the honor of working alongside some amazing and brilliant individuals from across the state of California, and also Ileana. So it's really great to be here and talk more candidly about the campaign. So as Flo was saying, there's a number of things that public health advocates do, and I think this was the California COVID Justice Recovery, Response, and Repair Initiative was a great addition to the roster of things that we were doing inside of the organization, just because of the impacts that we were seeing in regards to the pandemic on those marginalized communities and communities of color that we've been trying to mitigate harm from for quite some time. And so California COVID Justice is a coordinated public health response to COVID-19 and the deep-rooted inequities that it lays bare. So we're led by a coalition of public health leaders from across the state of California. And this initiative works to dismantle the structures and systems that have historically underinvested in communities and people of color and put them at greater risk for adverse outcomes. And so by advocating for needed policies, programs, and resources, we're pushing to strengthen the public health infrastructure across California and help communities recover from COVID-19 and respond to long-standing health and economic inequities, in addition to repairing the damage caused by systemic racism and oppression. So when we talk about recovery, response, and repair, this means helping communities recover from the pandemic, respond to those disparities, and also repair the damage from systemic racism. And as Dr. Flo said, we can't talk about health inequities and poor outcomes in relationship to people of color without addressing those ills that are uniquely linked to our history. And so the initiative's priorities and strategies are informed by a 9-person steering committee of public health leaders from across the state. And we'll talk more about the steering committee members on future slides. But what we're doing right now as our primary priorities is looking at how do we advocate for policies or create policy solutions that help to strengthen our public health infrastructure, address racism as a public health crisis, and establish health equity through new policies and an equitable funding framework, as well as increasing the supply of adequate and affordable housing with support services to prevent the growing numbers of Californians experiencing homelessness, and also provide direct economic supports to individuals and families in need. And I'll talk more specifically about each one of these priority areas on the upcoming slides. But when we talk about how we advocate, what's the framework for which we use to advocate for these particular policy solutions and policies, we do that from a number of different ways. But we're committed to being intentional and accountable to BIPOC communities. And the goal of our 2021-2022 policy agenda is to meet the needs of and implement positive changes for these communities. And our collective what we realize is that our collective success across the state will depend on recognizing and acknowledging the specific ways in which Black, Indigenous, and people of color are disproportionately affected and profoundly impacted by racism and racialized trauma, as well as oppression, and how those things show up in the form of policy. And so this focus acknowledges the complex intersectionality that exists. And so we can also throw into this framework, looking at issues of intersectionality around disabilities, gender identity, sexual orientation, class, and other identities that are part of systems that often affect marginalized communities. So our policy priority areas that we are working on right now, again, consist of addressing racism as a public health crisis, or what we call addressing racial disparities statewide and creating solutions that are going to help to address issues of racism across the state. And so what this looks like is advocating for statewide legislation such as the Office of Racial Equity, or creating race-conscious policy solutions, such as our 2022 priority, which will be the Racial and Cultural Equity Framework that I'll talk about on a future slide. And also strengthening the public health infrastructure, right? So what does this mean? So this looks like highlighting the disparities in funding for BIPOC founded and led nonprofits. This is a topic that's very near and dear to my heart, particularly as we watched through the pandemic. Who were the first responders on the ground level? Who were those individuals that were called to action to support communities that were most historically marginalized, disinvested, or who was called to translate documents for communities that had linguistic barriers in accessing information from public health? So when we think about these things in totality, what we recognize is that we really need to invest more in creating a holistic system of care between public health government entities, as well as our grassroots nonprofits. Because if not for our grassroots nonprofits, we don't get through this pandemic. And we had a lot of issues that we needed to address in regards to supporting these nonprofits and accessing resources to help sustain them and keep them afloat, particularly paying increasing salaries and wages for essential workers of color that were working inside of these nonprofits and doing the work of assuring that families and communities were supported throughout the pandemic. So that's a way in which we want to strengthen our public health infrastructure as we move forward. And we'll be proposing a racial and cultural equity framework to help divert funding to these nonprofits and to these communities so that they can sustain the work that they're doing. And so we're also looking at, as a third goal, to increase the supply of adequate and affordable housing with support services that expand rental relief programs to solve California's growing homelessness crisis. And so this looks like lifting up and naming that homelessness is a public health crisis. In California, there are over 160,000 people who are unhoused, and over 40% of these individuals identify as Black and African American. And if you continue to disaggregate that data, you'll also see that single Black women who are head of household are roughly about 60% of that 40% of unhoused population. And so with the diminishing COVID-related resources, so we've seen throughout the pandemic that there were a number of policies that helped to mitigate and in the form of rental protections and mitigate evictions. However, many of those bills have gone off, they're no longer in existence. And so with those diminishing COVID-related resources and the rising rental costs, the unhoused rate is constantly and consistently growing. And so we know that everyone deserves the right to quality, affordable housing, and we need to advocate for basic rights for our most affected communities who are experiencing homelessness and housing insecurities. And lastly, our priority areas to provide direct economic support to individuals and families in need through approaches such as guaranteed income programs, as well as reparation programs that we're seeing being modeled across the country as well as the state. We're currently utilizing COVID relief funds through the American Rescue Plan Act to support our most critical needs for underinvested communities and build an equitable recovery opportunity for these folks to have a shot at success. And I'll talk more about ARPA on the next slide. So when we talk about the American Rescue Plan Act, I'm hoping that through some of the work that we're doing and building grassroots movement, as well as some of our partners across the state, we've been talking a lot about the American Rescue Plan Act and utilizing this as an opportunity to support our most impacted communities. And so for those who aren't aware, the federal government passed a $1.9 billion relief fund early in 2021 to provide pandemic relief to communities and sectors of our economy. So included was $16 billion in direct funding to cities and counties in California. And so we decided to advocate for equitable spending of these COVID relief dollars because, as history suggests, we've had relief efforts happen in the past as recent as the CARES Act, which was horribly mishandled across the state. And many of those dollars did not go to the communities or the organizations who needed them the most at the height of the pandemic. And so what we've done through our advocacy efforts in helping community members, nonprofit leaders have a better understanding of the American Rescue Plan Act, we've created tools, we posted webinars. We've also created learning communities to empower community-based organizations and community members to access these funds and hold their local governments accountable to making equitable distribution solutions that are going to affect their communities and their constituents in a positive way. And so these funds offer Black, Indigenous, and people of color-led communities, as well as organizations, an opportunity to benefit from the federal aid and repair the devastating impacts that we've seen COVID have. And so simultaneously, these funds can also help to readdress, as we've been talking about, the longstanding underinvestments that contribute to things such as high poverty rates, underfunding in nonprofits, and reduced economic opportunities and limited access to affordable housing. So there's a number of things that that ARPA can be utilized for, and we're just using this as a mechanism to kind of model how equitable spending from the government can happen and have a drastic positive impact on outcomes for our community members. And so going into 2022, we're going to be expanding our work in ARPA and holding more listening sessions and community learning opportunities. So we'll share some information on how folks can get connected at the end of the presentation. In addition to many of these priority areas, one of our priority areas is to address racial and economic disparities in California by creating racial and cultural equity framework for the allocation of state funding and local government. And so once we create this framework, this is something that we want to utilize to help our state get closer to an institutional recognition that the root cause of health, economic, and housing inequities are really attached to structural racism. And while we've acknowledged this, we have yet to codify tangible solutions. So creating frameworks such as this that we can deploy during emergency situations will really help to mitigate those impacts that we've seen during the pandemic. And Ileana, I see you coming on, so I'm wondering, is my time up? Okay, all right. So all that to say, we cannot do this work without our amazing steering committee. And so these are just a few of the folks who are on our steering committee. And again, these are amazing folks from across the state. Many of these individuals are working at very high levels within their organizations, have vast connections in their regions, and are doing some incredible work around racial justice and advocacy on behalf of our BIPOC constituents. And so as you may see, we have a lot of work to do going into 2022. And with the support of the steering committee and their leadership, we're hoping that we can deploy our racial and cultural equity framework for state funding and build support around that. So make sure that you stay connected to us to learn more about the work that we're going to be doing in the future. Here's a couple of links, our social media handles. And if you have any questions for us, we'll be happy to answer them at the end of the presentation.
Thank you so much, April and Flo. This has been wonderful. It's great to hear both national and state perspective. And we've had such a great lineup of speakers. And last but not least is Hugh Nguyen, who will be sharing with us what's going on in Orange County. Let me tell you a little bit about Hugh. He has an LCSW and an MBA. He currently serves as the Orange County Healthcare Agency's first director of the Office of Population Health and Equity. The office aims to increase HCA's impact and actions related to addressing health disparities and advancing health equity. Hugh previously served as a director for system care at Mind OC, a nonprofit organization that seeks to collaboratively transform the mental health system in Orange County. Through public and private partnerships, he actively engaged community stakeholders to actualize the Be Well OC movement. Hugh also previously served as the Director of Clinical Services and Operations at Asian Pacific AIDS Intervention Team, a community-based organization serving medically marginalized communities. He also served as the Strategic Initiatives Manager for the Behavioral Health Department at LA Care Health Plan, where he oversaw population health and equity initiatives to increase access and improve healthcare for vulnerable populations. Hugh started his career at HCA as a clinical social worker in adult mental health services and transitioned to the Mental Health Services Act team to develop and implement OC Accept. He has extensive background in working with individuals experiencing severe and persistent mental illness and substance use disorders, and has conducted clinical and cultural competency trainings for both community-based organizations and large health systems throughout Orange County and Los Angeles. Welcome, Hugh, and thank you for sharing with us this equity initiative that you are launching.
Thank you, Ileana, and just with deepest gratitude to all of the speakers before me. I think we have a good idea of a framework that the two previous doctors presented, and then also from public health advocates, what's coming down the pipeline in terms of the work in the state, at the state level. And I have the pleasure of talking with you all and sharing with you all how Orange County Health Agency is embarking on operationalizing equity here in Orange County. Again, I am from the Office of Population Health and Equity, which is a new office that was established by the health agency in December 2020. So it's a fairly new office. And really the agency formed the office in response to the pandemic disparities that we were seeing that were compounded because of the disparities that were compounded because of the pandemic, but also the social justice movement that was happening throughout our country and all over the world in the summer of 2020. With that, the health agency went through a strategic planning process that really makes equity and health equity a strategic priority. So our visions, our mission, and our goals now are centering around population health and equity, as well as centering how we can work with the community in partnership with the community to operationalize health equity in our county. You see here the mission, the vision, the goals. So why now? Why do we want to work on equity in Orange County? And I just want to highlight some assets that we have to make systemic change possible here in OC. One is around the heightened awareness from the community of the impact of inequities. Hence the conversations that we've been having throughout this series that Mecca have been putting on. And then also, as I mentioned, HCA have a new strategic plan with greater focus on population health and equity, the creation of the Office of Population Health and Equity in partnership and working with the community to operationalize this in Orange County. What you see on the right-hand side is a visual of the OC equity map. I put down the website for you. For the first time ever, we can see at the community, at the Orange County level, how our communities are faring in terms of social and environmental factors that contribute to health. So the OC Equity Map is a map that has over 50 indicators of social and environmental factors. And you can type in your address, or you can type in the address where your office is at, and a dashboard will come up and show you how that community, that neighborhood is faring in terms of the social determinants of health. And then more specifically, one of the biggest assets that we have in Orange County, the Office of Population Health was able to secure almost $23 million from the CDC, which for a health equity grant, and which I'll go over really briefly in the next couple of slides for you. And so this is an equity grant from the CDC, a national initiative to address COVID-19 health-related disparities. This is the first grant of its kind in this scale from the CDC, granting over $2.25 billion throughout the country. We were fortunate to have secured $23 million for Orange County. These are the four strategies that all grantees from the CDC have to focus on. I won't go over this in too much depth, but really all recipient has to look at expanding existing or develop new mitigation and prevention resources, especially among unserved, underserved, historically unengaged or hardly engaged or populations. The second strategy is around increasing or improving upon data collection, reporting, and infrastructure. We know the issues and the challenges around data during the pandemic in collecting representative data and telling the story of what's actually happening throughout the pandemic. So the CDC really wants all recipients to focus on data improvement. The third strategy is around capacity and infrastructure support, especially for local health departments. So for my office here at the HCA, in building our capacity and infrastructure to support equity work. And then the fourth and most important strategies that the CDC and we will be focusing on is mobilizing partners and collaborators to advance health equity and address social determinants of health here at the local level. Again, here's some very high summary. $23 million, a 2-year grant, started in June 2021 and will end May 31st, 2023. The CDC is having conversation, but have not finalized whether they will be giving no cost extension, because a lot of the a lot of the grant recipients are struggling with getting this off the ground. The grant will be used to support and build capacity both internally at HCA. We heard a lot from the speakers around reflection and introspection of our own individual self, but also organizationally as we embark on operationalizing equity. So we will be doing a lot of that internal work, as well as externally working with and partnering with the community for action around social determinants of health and health equity. How are we applying this? What are our drivers of change or for change in Orange County when it comes to equity? These are four main drivers for change that we are following for the Equity and OC initiative. So the first one is around community and data driven. So how do we partner and collaborate with cross-sector public-private stakeholders, including traditional, non-traditional providers, but also including grassroots organizations that you heard April talk about in terms of their pivotal role in the pandemic response and the recovery that we're embarking on in the next several years and decades. So how do we bring the community together, utilizing a data-driven approach, not only the quantitative data, but the narrative and the lived experience of our community members and with diverse voices at the table. So that's our driver for change, number one. The second driver is around beyond programs and services. How do we think about addressing high priority social determinants of health? And so we want to partner with the community to identify and prioritize for Orange County what are those 3 social determinants of health action areas we want to focus on in the next 3 years to lay the foundation for what this work might look like for Orange County and its residents. And then third, and for me most also very critical, is around ensuring equitable participation. How do we make participation possible for all stakeholders, including traditional and non-traditional providers, including small nonprofits, grassroots organization? So it's not about just expanding the table, but how do we create mechanism so that those who have historically not engaged, or we haven't done a good job engaging, be able to participate, be able to be at the table. So that's the third priority or third driver that we're really focusing on through the Equity and OC initiative. And the fourth one is around collective capacity. How do we build capacity among our own organization, our partners, as well as the community as a whole, for us to come together to work on advancing equity here in Orange County. So the work isn't siloed work and equity light work, but the work is around building the capacity for Orange County to address the different determinants of health and the inequities that we're experiencing. So those are the 4 drivers that is supporting our Equity and OC initiative through the CDC grant. I won't bother you with this, but just know that this is sort of our framework and a pathway for us to achieve equity in Orange County. At the top, the Office of Population Health and Equity through HCA will be focusing on internal actions within HCA to conduct a self-organizational assessment to really assess our internal policies and practices, and really building the population health and equity capacity and infrastructure for our organization so that we can better serve the community. And then the external action is really in partnership with the community for planning and engagement, going through a data-driven process and leveraging and expanding on existing partnerships that we have. The middle piece is where the action will be in terms of the OC Equity Coalition. We want to convene a coalition together that is cross-sector, including traditional and non-traditional providers, especially grassroots organization. And that coalition will go through a process of identifying and prioritizing what are the 3 social determinants of health action areas we want to focus on. We want to be aligned with other systems, with other partners in the community to, in order for us to begin operationalizing equity in OC. And then the piece on the bottom is where we are hoping to build collective capacity in the different populations that you're seeing here indicated. So creating priority population health equity collectives. Those collectives will be working on the priority of that community and the community that they're serving specifically. There will be participation grants. So as we are looking to build that out, what that looks like for participation grants of individual organization, and then also the capacity building grants for the collectives, we will be seeking and touching base with community-based organization and the community to help guide our planning and our thinking around these opportunities for funding through participation grants and implementation grants and collective grants. I will definitely be putting my email and contact info in the chat. And I think I'll end this by saying that we do believe that with equity in OC, equity in Orange County, equity in our communities, believe that it is possible for us to operationalize if we can follow these 4 principles, making health a shared value. I think it needs to be beyond shared understanding, but really moving towards making sure that it is a shared value among individuals, but also organization around how do we, what do we need to do, and how are we going to do the work in a way that promote equity as a shared value, making sure that we foster cross-sector collaboration to improve well-being, and then also strengthening integration and alignment of health systems and services in order for us to do this work together. And then definitely advancing equitable policies and practices in our individual organization, but also as a system in Orange County. I'll stop there. I know that we want to go into Q&A, but I'll definitely leave my contact information in the chat box.
Thank you so much, Hugh. And I'd love to invite the rest of the panelists and presenters to come and join us. Turn on your camera. That was such a great lineup. And this is amazing work and amazing insights that we've shared today. But I'd like to invite us back to talk about, how do we navigate through these changes? This is a new moment for us, and sometimes we experience resistance, especially from dominant groups or when we're disrupting current structures. So I'd love to hear from all of you any best practices or lessons learned or insights that you have as we move forward. Feel free to start. What are some ideas that you have or experiences that you've had in creating policy and systems change?
I think we can all agree. I know that I can, agree with this, which is that this work is hard. And it is not about just disrupting and dismantling culture that exists within one group, right? But also the internalized experiences that we all have, whether that's heterosexism, whether that's racism, et cetera, and the internalized piece. And how do we also dismantle that? How do we deconstruct that? And so I find that some of the part that is really challenging that I find and colleagues of mine have had is really around, like, not all skin folk are like kinfolk in this work, right? And so how do we have that honest conversation? How do we make sure that we foster this shared value around what equity is and what equity entails, right? Because some of what equity entails is not about what is my piece of the pie, but it's about, what is the a smaller organization might need, that I need to give up my piece of the pie so that we can create a more equitable playing field, right? So that we have a more equal starting point. So I find that and I don't know what that looks like yet. I just know that conversations like this is very helpful. Being very transparent and being very honest about the challenges is critical. And having those very tough, uncomfortable conversations with folks. Thank you.
So great points. And I would just add to that to try not to get derailed or distracted by the vocal minority. So, those who will be actively opposing your efforts often will try to consume the space and consume the room. And so once you're clear that those people kind of aren't, for the most part, movable, but instead to really focus the attention on those who may be more neutral, who are more unaware, who are more open, who, as you were sharing your research, have a curiosity but don't have the knowledge. And so then we're able to make shifts even in the face of the opposition, which also involves what I like to say, the meeting before the meeting. That when we're trying to do transformational work, there is a lot of the behind the scenes coalition building so that we can get it done.
I would like to add to that. I think one of the things that I was sharing with a colleague of mine recently is that, while the pandemic has illuminated our disconnectedness, it also has really illuminated where we are very interconnected. across like-mindedness, across our desires to really achieve justice for our most marginalized and impacted communities. And I think that, as a best practice, I've really been trying to lean into those spaces. And I believe that we've kind of been a little gaslit in thinking that, there is a dominant presence that really is dictating, how we live, thrive, and think in some of these spaces. And I'm starting to see that really, there's a paradigm shift there, right? That, those who have values of justice and equity and cultural responsiveness are becoming the vocal majority. And I think we need to just continue to hold that line and lean into those spaces where we are a collective and we are en masse. And I think we use that energy and that interconnectedness to continue to promote and activate transformation.
I want to there's a question that came up in the Q&A that I thought I would ask. I know we have a few minutes left. I thought this might be an interesting one for folks to respond to. I think it comes up so much. It's like, are there, what do you recommend to folks who have to have these hard conversations with friends, family, loved ones, neighbors, co-workers, whatever it may be? What are some things that people can think about in doing this and trying to keep the conversation, initiating it, sustaining it, and keeping it going? And any recommendations or thoughts anyone wants to share?
I would say that it's helpful to share our own stories and our own exposure. So if you think about a group differently than how your parents or grandparents think about them, then where did you get your thought from, right? And so narratives are pretty powerful. And what we know, just even empirically, is statistics don't really shift people's ideology. So I can kind of rattle off numbers and people say fake news, they don't believe the numbers are real. And so the storytelling and then trying to connect with the stated values of this person. So if your grandmother or your father claims whatever this principle is an important principle to them, and the fact that that goes against how they are speaking about that group, to speak about it in that way. And then the last thing I would just add is, while we feel an intensity and there is an urgency to it, to try to have some spaciousness in the conversation, because sometimes when we lead with our outrage, then people don't even hear the content of what we're saying. And I'm aware that there is also a lot of communication about how we shall not be censored and we have to have space for our rage. And I would say the space for my rage is not the same space where I'm trying to convince somebody of something.
Wow.
I think that's a really powerful point. And I wanted to bring up something that's kind of been coming up as we've been doing some racial equity work with our executive team, has been the lack of transparency in our conversations. And so I think, I think Dr. Thema is really bringing up an important point around how do we have these relationships and all of our communications aren't the same? And what I find one of the things that I'm really trying to root out is the way in which we sometimes don't hold complexity, and it impacts the authenticity and the intimacy of our relationships. And I know we're not used to talking about intimacy at work or intimacy outside of often romantic relationships, and maybe, the more evolved among us are friendships. But intimacy is at the root of what we're trying to do here, is see and understand each other and build a connection. And when there are things that as white people you won't say because you're afraid, when there are things that as Black and Indigenous and other people of color we won't say because we're afraid, we don't have an intimate relationship. And I think that's really important. And so we need to be able to say, and we also need to recognize that sometimes we hold positions of power in an organization and also our subjugated selves show up, right? And so I am a Black woman. I also am the senior director of policy in an organization. And so that means that I'm holding both institutional power and institutional disempowerment. And so sometimes when I'm having a conversation with an entry-level staff person who may be a young white woman, I am there both triggered because of racial things that are happening. And I'm also power in her, in her experience in terms of the ability to hire and fire and the ability to do things. And it's complex and we don't talk about it. And instead, I'm really thinking about a specific instance instance where something happened that was very triggering to me of this person. And I shied away from having that conversation with them because I was just like, this is a dangerous white woman and I don't want to deal with this anymore because it's not safe for me. And not recognizing that in that experience, though, I also had institutional power because it's not how I'm used to seeing myself. And so there is a way that we have to be able to own the complexity of being able-bodied and cisgendered, and also Black and in a body identified as woman. We have to own institutional power and institutional disempowerment. And I think our brains are not primed for complexity often. We want to drill things down to being very simple. And it means that our relationships suffer as a result. So I don't know if I have answers for that, but I think one of the main things that come up is that we're going to try things. And the hope is that we all make new mistakes each day. Not that it's going to be perfect, because perfection is one of the tools of white supremacy. It's like, don't do anything if you're not going to get it absolutely right. And that's just not the way to be. We should be thoughtful and intentional, but we also have to recognize that it's not going to be perfect. But it also means that we have to kind of shirk away from some of maybe the ways that we've been ingrained to be professional or to do things, and to actually say the things that are hard and acknowledge them and be careful about them, but also not shirk away from them because they're showing up and it's like the elephant in the room.
Well said, Dr. Flo. Well said. Well said. Everybody's well said. I know we're at time. Do we need to wrap up, Ileana, or should I ask the last prompt?
Let's go a little bit over time.
Okay,
and
all right,
also, there's a survey link in the chat box. If folks could also fill that out.
If anyone has to chime off, please do. There was a question that someone sent from the UK who joined us from the UK. I thought it would be interesting just to get your. They asked, it's Kirat Mystery, I believe I'm pronouncing it hopefully correctly. Asked, what will success look like from your perspectives in 12 months' time? I'm just curious. Actually, I thought that's an interesting question, and whoever wants to respond, and if you have to sign off, we understand as well. So, is that a tough question?
Success will look like holistic health and wellness for all people, especially marginalized people, with the understanding that health is greater than the absence of disease or illness, and that we are speaking and addressing the disparities, and so we're seeing a shift in those disparities. So, when we have real results, as our other presenters have talked about, it should show up. Like, it's not just a feel-good moment of we had a potluck with food from different countries, right? But that there should be measurable impact, not only in the people that we serve, but also those who work within the institution.
Mm-hmm. Great. Thank you. I see.
For me is, I think, a long term, right? It's where people get what they need in terms of resources, in terms of services, etc., when they need it and with urgency, right? I think for us in the short term, because I think the question was 12 months, and that's a much more trickier question than, to answer to. But I think for us with equity and OC is really having common language, because it's oftentimes we need to start there. And I think our county is at that point of just contemplation or pre-contemplation around this, right? There's been declarations of support and et cetera, but there hasn't been as much in terms of action collectively. And so, shared common language, and then if anything, shared value to deconstruct what it means to be, to do the work and operationalize equity. I think there is still a lot of work to be done there. I think a lot of people conflate equity with equality, right? Equity work with a more ethnocentric kind of standpoint than a solidarity framework. And so 12 months, I don't know if we can get there, but just a shared definition, shared understanding of what health equity is, that would be great.
Great, thank you. Any other thoughts? Yeah, I think we should. Yeah.
Yeah, and then that was the purpose of having this equity series, is to just get us on the same page in terms of the language and the concepts, and hopefully this is a jumping off point, Hugh, for the future work that you'll take on in 2022. Thank you all for being here today. You're doing amazing work. I am so excited to continue to follow you on Instagram, Dr. Bryant. I feel like you're always talking to me when you post things.
I am. I'm glad you got the message. I'm talking directly to you.
She's personalizing it already.
Yeah.
And thank you, public health advocates, for being here today. Continue the good fight at the state level. We need you. And thank you, Dr. Lisa, for sharing your perspective, and Miguel, of course. Hugh, thank you for being here today. Thank you all. And we will be sharing the PowerPoints and the recordings after this. Thank you all.
Really, thank you, Mecca, for your leadership in having these dialogues. So thank you.
You're welcome.
Thank you, everybody.
So much.
Bye-bye. Thank you.
Bye-bye.